Hi, my name is Dr. Doing spine surgery. My area of interests are minimally invasive spine surgery, spine deformity correction, revision spine surgery, and we also do cervical spine surgery. So there are a lot of misconceptions about the spine surgery, and the patients who come to us, they are most of the time worried about not only about the results of the spine surgery, but also about the future implications of spine surgery. So I just wanted to clarify some of these things. So one of the primary concern of the patient is that after the surgery we'll have to take a long duration of bed rest. The other concern they have is that it should not happen that after the spine surgery they will develop any kind of paralysis. They are also afraid that because of surgery they should not be requiring more and more surgeries in the future. So the issue is that spine, obviously we are dealing with the nerves, and we are working next to the nerve. So theoretically there is a possibility that the nerves can get affected during the surgery, but a nerve getting affected during surgery has less chance than you having an accident while being on the road, because there is only one driver when you are doing surgery, nobody else is coming and hitting you. And with the latest technology, with the help of the microscope, with the help of neuromonitoring, where you are checking the nerve function during the surgery, the chances of developing any kind of nerve injury or paralysis during surgery is almost next to nil. Um, the second problem which patient feels that we'll be having a long duration of bed rest. So in the past, when the technology was not that efficient, and even the decompression surgery where you are just releasing the nerve was requiring a big incision, and for a single level disc removal people used to take like 4-inch long incision. Compared to that, nowadays most of the surgeries can be done in minimally invasive fashion, where for 1 or 2 level just 1 inch of hole or even less than that is sufficient. Even if you have to do instrumentation surgery, these new screw system, they are so solid, they are so robust that in majority of the cases, unless situation is something different, in majority of the cases you do surgery today and next day you are able to sit and walk. For the patient who have pre-operative weakness, they obviously take time to recover, but for the normal patient who was walking before surgery, there is no reason why they should not be sitting and walking on the very next day after the surgery. The biggest concern, and which is concern from our point of view also, is that um, the need of revision surgeries after spine. So what happens that spine is not a single structure. Spine is made up of multiple different bones, and between these two bones there is a disc. So there are many discs in the lumbar spine, in the thoracic spine, in the cervical spine. So if you do surgery at suppose L4-5 disc is out, you do a discectomy kind of procedure, then the remaining disc can come out again. It happens in about 2 to 3% of the cases that the disc can come out again. Mostly it will happen in somebody who did not take proper care of the back after the surgery. So that's a real problem. It can happen, and but if it does happen, then you can take care of it again. Now why it happens? Because the spine is a dynamic structure. You are just removing the part of the disc which has come out. The remaining part of the disc which is still there inside can come out again. It can degenerate further and can maybe cause back pain also. But even for the cases who develop problem again, they can be very well treated nowadays. In case of instrumentation surgery, people feel that their back will be very stiff. They will not be able to do their day-to-day activities. But as I said, spine is multiple jointed structure. So even if you fuse few levels, the rest of the spine is still moving. So your daily life is not much affected. The other problem which we face even with a very successful surgery is that suppose you have fused L4-5 or L5-S1 level, so that level movement is gone. So the next level movements are increased. So theoretically, there is a possibility that because of that increased movement at the next level, that level can degenerate and can have problem in the future. So the biggest misconception is that you take care of the spine once and then the problem should not happen again. So unfortunately that kind of possibility is not there. You patient need to understand that it's not a single structure, it's a multiple jointed structure, and it's a dynamic structure. So you take care of the problem once. If the problem happen again, you can take care of that again also. Nowadays most of the time we use microscope. There are endoscopic techniques also available. So what it does, that it gives us a lot of magnification, so the visibility of the nerve is better. We are able to do a more thorough job inside. The nerve decompression is better, and these all can be done with the less soft tissue damage. So this will help reduce the blood loss during surgery. It will help in faster recovery of the patient. The post-operative need of pain medicine also goes down. The patient discharged from the hospital and going back to the work also is faster. Even instrumentation surgeries also can be done with the minimal invasive technique in the percutaneous fashion, where you don't have to take a big incision. With a small hole only you can fix the spine. So with the help of all these things, not only the spine surgery has become safer, where your results are very predictive. So as long as you have chosen a right patient and your indications are right, and you have executed your procedure which you have chosen in the correct fashion, the results are almost guaranteed. The other thing is that there is some amount of care required after the surgery. So little bit of weight reduction, a little bit of activity restrictions are always required. Now what happens, that the other thing is, patient feel that if you are going to a spine surgeon, we are definitely going to need a spine surgery. So that is also not true. 80-90% of the patient, they get better by physiotherapy, medications, and by activity restrictions and taking care of things in day-to-day life. There are some injection techniques also available, wherein we do inject in the back with some pain medicines, and the patient symptoms are significantly better. So what happens that we use these techniques when we have to buy time. Sometimes patients are not ready for the surgery immediately, or they are not the right candidate for the surgery. In those kind of situations, injections procedures are very, very good. Sometimes we also need confirmation. We see problem multiple level, but we want to make sure that from which level the problem is coming. So in case a surgery is required in the future, which level we need to do surgery. So with the injection techniques, we kind of make sure from which particular level the pain is coming. So the predictability of the surgeries have increased quite a bit nowadays, because of improved diagnostic methods, because of improved surgical techniques, and recovery has become very, very fast. I am also available at Pinnacle Hospital on Wednesday and Saturday in the morning session. So we do all kind of surgeries here also, including deformity correction, cervical spine, and even revision spine surgeries also. And if you have any question related to spine, please put your message or question in the comment box, and I'll be happy to answer that. Thank you.